Welcome to today's video. Today I will be talking about foramen of the skull. Foramen of the skull is a very important topic while studying anatomy. So let's begin. So what is a foramen? A foramen means a hole or an opening that can allow various structures to pass through them. These structures can be nerves and vessels. So let's begin. I will start from top to bottom in the frontal view. So let's start. This very first foramen that you see is called supraorbital foramen since it is above the orbit. Next we have optic canal. Next one is superior orbital fissure. Then we have inferior orbital fissure. Here on the cheek area it's called zygomaticofacial foramen. Down here is infraorbital foramen. And lastly we have mental foramen. Okay, we'll go over them one more time. Supraorbital foramen, optic canal, superior orbital fissure, inferior orbital fissure, zygomaticofacial foramen, and lastly infraorbital foramen. Now I will be talking about two foramen of the mandible. So one here to the left is called mental foramen, which is seen anteriorly, and the other one here posteriorly is called mandibular foramen. These are the two openings of the mandibular canal. Now this is the other view, which is the base of the skull. So this foramen right here on the top, it is called incisive foramen. Then we have two small foramen over here, greater palatine foramen and lesser palatine foramen. Greater palatine foramen, lesser palatine foramen. Okay. Next one over here, oval shaped foramen is called foramen ovale. So it is named after its shape, foramen ovale. This small foramen right next to foramen ovale is called foramen spinosum. Okay. Then we have this big foramen over here, which is called foramen lacerum. Okay. This opening over here outside is called external acoustic meatus. Okay. Then we have this opening here, which is called carotid canal. You see this J-shaped foramen? It's called jugular foramen. Next foramen right next to the styloid process is called stylomastoid foramen. And then this big foramen is called foramen magnum. Magnum means big, foramen is opening, so big opening, foramen magnum. Okay. So the first one was incisive foramen. Next we have greater palatine foramen. Next we have lesser palatine foramen. Then we have foramen ovale, foramen spinosum right next to foramen ovale. And we have big foramen lacerum over here. External acoustic meatus. Carotid canal here and here. Then we have jugular foramen. Then spinomastoid foramen. And lastly foramen magnum. Okay, let's go over them one more time. This is incisive foramen over here. Then we have greater palatine foramen, lesser palatine foramen. Here we have foramen ovale, foramen spinosum, carotid canal, jugular foramen, foramen lacerum, external acoustic meatus. Lastly, we have stylomastoid foramen, foramen magnum, and this one here is hypoglossal foramen. Now this structure is so this view is a different view if we remove the brain from the skull and look inside. This is the structure that we see, and we have a number of openings in this view as well. So again, I will go from top all the way to bottom so that it is easier to remember. So the topmost foramen over here is called as foramen cecum. Okay, and it is right above the cribriform plate, which is this structure over here. Okay, then here are the opening is the opening called optic canal, which we went over in frontal view before this. Then right next to it is superior orbital fissure over here. Then we have foramen rotundum. Rotundum means round, so this is a round foramen. Okay, then this is again repeat foramen ovale. Right next to it is foramen spinosum. Okay, now remember what this big foramen was right next to foramen ovale? Yes, it is foramen lacerum. We had an external acoustic meatus in the base of the skull, so now here we have internal acoustic meatus over here. Okay, then we have J-shaped jugular foramen, hypoglossal canal or hypoglossal foramen, and then foramen magnum. Okay, this is a closer view to take a look at foramen cecum, optic canal, superior orbital fissure, and foramen rotundum. Here we look at the other foramen, foramen ovale. Right next to it is foramen spinosum. Above it is foramen rotundum. Here foramen lacerum. Okay. Down here is the internal acoustic meatus. Then we have jugular foramen over here. Foramen magnum, hypoglossal canal. Thank you so much for watching this video. I hope it helped you study your foramen a bit. And please let me know if you want another video with structures that go through this foramen in the comment section.